I think the most important thing is this awareness, to give people an opportunity to see the facts so that they can make a determination. They can weigh the benefit of bringing their family to the dentist on a regular basis so that they ensure good oral health. I think we have to find ways, and frankly we are looking for ways to encourage this awareness. I wouldn't say frighten people, but I think that sometimes people need to be prompted to think that this is more about just smiling with white teeth, that it's about heart disease, it's about low birth weight babies, it's about other things that are important.
I think many organizations in the oral health care community, many dental organizations are, especially during this period of healthcare reform debate, are trying to raise the profile of oral health, trying to combat the lack of knowledge, the ignorance on the part of healthcare policymakers, and attempting to have them begin to understand that when we debate healthcare reform in this country, we have to also include oral health.
The research that we have is clear in understanding what are the, at least in regards to periodontal disease, what are the major predictors of periodontal disease and periodontal breakdown. And I think the research is becoming clear as to how periodontal conditions can actually affect general health and well-being in important ways, particularly in an aging population. I think if anything, we know that prevention works, and prevention is probably the best way to manage problems. That can mean both preventing the occurrence of disease, but as importantly in an aging population, preventing the progression of prior existing disease. So I think the research shows that we know how to prevent disease and control it, and I think the challenge is providing the services to those who need it in a practical and cost-efficient way.
The way we're viewing healthcare reform is as an opportunity to provide greater access to care, but more importantly, greater preventative care. And of course, so much of the preventative care takes place in the office-based setting, whether it's in the dental office or in the physician office. And we think that providing further access to preventative care will be, of course, good for public policy, good for the nation's health, but will also, in the end of the day, be a way to reduce the healthcare cost, because diseases will be treated before they become acute. And therefore, this healthcare reform notion of access to care and greater care on the preventative side in the practitioner's office is, of course, good for the nation.
Apple Tree, it's a nonprofit organization, and it's a staff model, which is kind of unique. It's an organization on a mission to provide dental care for people that face barriers to care of all ages, from low-income children to adults with disabilities to seniors that are living in nursing facilities or other senior living settings. It is possible to create a business model that's nonprofit, that's mission-driven, that can generate enough ongoing income through public and private mix, along with some philanthropy, and be able to provide really high-quality, comprehensive care for people of all age groups.